Amazing. So I'd like to start off with an introduction about both of you.
Hi everyone, great being here. Thanks, Oman. I'm an investor in a fund called A Squared. We started this fund about 6 years ago. We're investing out of our second fund. Early stage, as early as possible, we invest purely in digital health. So for us, that's the intersection of people and software in the US healthcare system. I'm a physician by training, so can very much resonate with things that have been discussed here before. Great being here.
Amazing. And what about you, Moran?
Hi. Likewise, great being here. I'm Moran Snir. I'm the co-founder and CEO of Nest Genomics. I've been working for the last 20 years on developing software companies that increase access to genetic information, and Nest is my fourth company in the space and part of Nadav's portfolio.
Could you tell us a bit about Nest Genomics?
Yeah, thank you. Nest develops an AI-native platform that helps operationalize precision medicine. If you have Nest, providers can identify patients who need genetic testing, knows to order the right test for them, and then knows to manage them based on their genetic information and results. We sell to health systems across the U.S. We're in about 20 health systems and 300 clinics or kind of like healthcare networks.
Amazing. And Nadav, could you walk us through why you invested in Nest Genomics? I'm going to start with the hard questions first.
It's not hard because of Moran.
Right.
No, I mean, to be honest, as early stage investors, you realize the more you invest, everything will change except the people. So this is first and foremost about the people. Mm-hmm. Now, you want to have a thesis beyond that. But I think especially in healthcare, you ask yourself, what is the right to win for a specific team? And I think we've interacted like a year before Ness actually started. And, given Moran's and her team's background in this field, it was very, very apparent that they have a right to win. Beyond that, I was as a physician who hated biomol and genetics, kind of like to the level of this is far too complicated for me to really grasp. And seeing so many physicians who are deferring the use of genetics because it is like a fraction of their curriculum and they are afraid to use it because they're afraid to make mistakes. And as a consequence, as a derivative, many patients do not enjoy the benefits of clinical genetics. I felt like this is a very timely play. So overlaying that with the team's capabilities made it a really no-brainer.
Makes sense. And Moran, hard question for you. Why did you want A Squared Ventures on your cap table?
So like Nadav said, I think that, so I had several companies before Nest. The first two were kind of like bootstrap. The third was a venture-backed YC company that we sold to a large genetic testing lab, and then Nest was the fourth, and really kind of like had a longer time to think about who we'd like to join. And these conversations that I had with Nadav for a year were very impressive, just I think both in terms of his interest in trying to make the effort to understand the genetic space. It is a space that not a lot of people kind of like understand the nuance and the barriers, kind of like the challenges around it. And then I was also impressed by kind of like his effort to, we've not had this conversation, I now feel closer to you. His effort to understand the ecosystem at large and just learn about kind of like the larger things that are happening in the U.S. health system, including moving to the U.S. and establishing A2 here. And then kind of like even larger than kind of like that relationship and being impressed by Nadav, A2 being connected to Arkin Ventures and kind of like the additional arms they have as part of their overall investment capabilities and oversight, and especially in the pharma space, like were very interesting to me. And I thought that that could long-term be strategic and interesting for Nest.
Nadav, I'm going to get back to you.
Thanks.
Yep. I'm going to get back to you on A Squared Ventures and how that kind of unfolded.
Yeah.
But another quick follow-up I have for you, Moran, is you mentioned that you started and sold a business as well. So I'm assuming you've had investors on the cap table before. So my one question for you is, even your relation with Nadav took a year before it turned into an investment, how did you approach fundraising the second, the third time? And was there anything different that you did compared to like the first time, essentially? Is there anything that you had an emphasis more or less on?
I think that like in the second time we had kind of like more, maybe we had more options just because we created more relationships and it was easier in that sense. But in terms of the approach, we actually took a very similar approach between the first time and the second time for our seed round. So both kind of like for Clear Genetics and for Nest, we went through Y Combinator, and we took the approach of being kind of very targeted in the time that we're spending for fundraising to get kind of like the initial business off the ground. We knew that we want people who understand the space or specifically kind of like knowledgeable about healthcare and genetics as much as possible. So we have kind of like Anne Wichkigi, who's the founder of 23andMe, and some other kind of like major lab investors and healthcare investors the second time. But kind of like that approach around getting to being able to scale our business or kind of like try to start the business as fast as possible with people who are excited was kind of the approach both times.
Yeah, makes sense. Nadav, my question for you is, how do you think about investing in early stage companies, both from a personal background of yours, but also from the company perspective?
I think I can address this question in different ways. I would say that in my former role before establishing A Squared, I had an operational role. I led business development in the largest HMO in Israel, Clalit. It's a 1,500 clinic, 15 hospital, 5 million member systems like Kaiser Permanente for half of the Israeli population. And we actually had an in-house clinical research institute. We've developed decision support tools a decade ago. And still, as an inside shop, it was so challenging to implement these tools. And you start to learn about the challenges. And also, being a physician, I worked for a hospital before that job where we had our own self-developed EMR. So we had lots of gadgets and tools that were introduced to us. And these eventually ended as sticky notes on the screen that helped us to avoid the pop-ups of these decision support tools. Long way saying it's super hard to innovate in healthcare. Mm-hmm. So I think for me, we're trying to look for people who are really cognizant on this difficulty. And again, this right to win, like who would actually listen to them and why? And eventually who would buy this and why? This is for us the key question, not how cool is the tech, how solid is the tech. Of course, it's important, but it's kind of like the cherry on the cake and it's not the cake itself. Mm-hmm. I think that's the gist.
Gotcha. And in terms of your investment thesis as well, what does it take to write the first check? And what does it take separately for a follow-on investments in some of the companies that you've already written a check for?
Well, we invest in different stages. I mean, as an example, we just incubated a company. We just created a company based on a thesis we had. We didn't meet irrelevant companies. So we took that journey and eventually established a company all the way towards kind of like early A. So obviously, these are different types of checks we are writing. Mm-hmm. And the level of conviction is different based on, the stages. Of course, when you meet a very early stage company, it's mostly about the team, getting to know the team, getting comfortable enough with the team. And the more mature the company is, you have more data points to consider. So it really varies between the different stages.
Gotcha. Moran, is there anything that you had to unlearn from some of the early conversations that you had with investors for your current company?
I'll see YC as an investor as an example, because I think they're kind of very core learnings or insights that they have in terms of like building startups, and one of them is kind of like doing things that don't scale at the beginning, and I think that is something that kind of is very core to how we started the company and what we looked at in kind of like getting our first customers, being able to build the product, understand exactly how to support everyone and what is needed and what isn't in terms of the product. And then as we're growing, we need to kind of like unlearn how to not do things that don't scale and stop doing things that are manual or need a lot of hands-on of our team, and just kind of like build around automation on the things that we know that work, and be able to learn kind of like how to grow quickly in an automated way.
I'm curious, is there a reason you chose to go through Y Combinator a second time? Is it that, you knew you wanted to go into Y Combinator again, or it just happened?
No, I knew that I want to go through it again. I think that YC added, so actually a lot of, you asked this before, many of the investors that invested in Clear Genetics also came to invest in Nest, and YC is one of them. We saw a lot of value in kind of like participating in YC, not just because of kind of like the fundraising, which I think is a very focused process that they have through YAC, but also just kind of like the relationships within the community and the network itself. I think that adds a lot of value, and I think it's kind of like one of the resources that I turn to first every time I want to do something. So if we're hiring, if we're looking into building kind of like a provider network, if we're looking at a new service, like that's always the first resource that I turn to. I'll also add that I feel this, like I feel very strongly that as a founder, you're kind of like telling the story about your company, and you have one story that kind of like is your investor story, and that's really where you want to go. And then you have like the story that you kind of like work on every day with your customers and with your team, and the things that need to be done kind of like on an operational level. And a lot of times those kind of like, people are in a spot where they need to build their company and fundraise at the same time. And I think that's, two very big undertakings that are hard to do at the same time. So one of the things that I like about the YC is you have that time where like you're focused on fundraising, and you have enough money to go and build, and then you can build and then go back and fundraise if you're fortunate and the stars align.
Nadav, does it matter to you who else is invested in a specific cap table of a company at a given round?
The shorter answer is yes. Of course, there are different structures and different elements. I think, first and foremost, we don't want to be alone on a cap table. I think healthcare is too complicated for the investor to tackle, on its own. And you need to have, different perspectives around the table. More network is always better, and so forth and so forth. So first and foremost, the tendency is not to be alone on a cap table, if that's possible. To date, we've not invested alone. Like lead, we are looking for somebody to join, and so on and so on. Sometimes we co-lead. There are a very limited number of funds that we don't have good prior experience with, that we will try to prevent working with, to some extent at least. Nothing is like a deal breaker, I would say, but there are by nature people that you prefer more to work with, and people that maybe less. I think that's the most candid answer.
If you're able to share, how many of these conversations that when you're looking at a cap table are investors that you're bringing on to invest as like a co-investment, or do you just kind of observe what's happening?
I think that's a very interesting question to address, and Moran, I would be curious to hear your thoughts as well, because sometimes we track intros we're doing, and sometimes we can make intros for a company. I mean, it's a different situation where you haven't invested versus when you're already in and there is a next round. Like when you're already in, it's you're biased to some extent. So making introductions to other investors, we try to be as kind of like as hands-off as possible, kind of like, this is our company, they're fundraising, we think they're great, we're not objective, so please meet them and take it from there. We have done like 50, 60, 70 introductions for companies during fundraising. I'm not sure if that's the best thing to do. I think founder that is advising a fund to speak with another founder is the best way. Like if for founders here to back channel, that might be actually more efficient than asking your investors to make these introductions, because these are more genuine. So that's one. I think two, when you try it's a very special moment when a round is being constructed. I mean, this is the time where people are like really trying to fight for allocation if it is a competitive round and so forth. And as a lead, you really want to try to bring value-add investors that you trust, to the cap table and trying to provide the argument in their favor, with the founders. Sometimes you can do it. Sometimes founders prefer others, and that's also great. So it's a very collaborative dynamic, I would say, but it can take many different shapes and forms.
Sure. Anything to add, Moran?
The only thing that I'd add is don't take it, kind of like interest from investors that are not investing in you. So like a lot of the times kind of like there were investors that are like, oh, you want me to introduce you to another investor? If that investor isn't investing, then it's best that they don't make an introduction to another.
It's a great point. I think it's a bad signal when, an investor is like, I don't want it to invest, but maybe I'll give you I'll do you a solid and I'll introduce you to someone. It doesn't look good. So I would avoid that as a founder.
Right. And that kind of leads me to my next question. I know with A Squared Ventures, there's a lot of experts, a lot of technical, people on the team that are kind of able to go through these companies and the investments, but also support the founders and the companies through, stage after stage. So could you tell me a bit from your perspective why it's important for founders to kind of pick the right investor?
I think maybe I'll address the question a bit different. I think are the founders here? Let's make this more interactive. Anybody like working on a company? Or maybe future founders. I would say like investors are, trying to understand if this company is a good fit for their portfolio. I think founders and teams should do the same thing. It's a marriage. It's not a date. And it can be a very long marriage, hopefully at least. So I think you need to find your right investor. Some founders really want capital and that's it. Like capital and stay out of my way. And that's okay. I mean, some people prefer that and that's great. Some people are actually interested in, value add, which is a very big word. And you need to find that right, alignment. For me, at least, what is of interest for me is working with the companies. It's not making the investments. That's the fun part of our work. I think we get the chance to really observe from within what's going on, hopefully to help, hopefully to affect the company journey. And when things evolve, like you make an introduction that is becoming like a customer. Like I had this, occasion where one of my companies, not Nest, was struggling. Some companies do struggle, in VC, it's always like, hey, everything is exciting and everything is doing great, but it's not the real world. Don't believe LinkedIn, in other words. So we had one company that has been struggling and actually was on the verge of going out of business. And eventually they were able to secure additional fundraising and really went off to the races. And we were trying to be supportive during that process. And after everything was done, about a month afterwards, I'm getting a phone call. It was Friday, 7 p.m. And it was the CEO. And he was like, I'm sorry, I'm maybe hurting your Friday dinner right now. But just for you to know, we signed that contract. And I want to thank you that you believed in us. And I was like, this is why it's worth it, So that's for me why we're doing it.
Yeah, it's always helpful to have people kind of in your corner. So makes a lot of sense.
I think so.
Yeah. Question for you was kind of on your company and the changes you've seen year over year. So with kind of like all these changes happening in the AI space, obviously your company is built on AI. What are the biggest changes you've seen over the past 2-3 years?
I think, so kind of like just in terms of kind of the AI, that changed a lot. Everything, all of our approach around like how we build things and how we think about things, from kind of like not just the AI features within the platform itself that we added over time more and more, but everything from kind of like how do we design things to then how the engineering team works, all of our meetings that are now transcribed and where that goes. The bottlenecks in our company changed from kind of like being bottlenecks with the software development to then kind of like becoming bottlenecks more on kind of like the product requirement side. So in terms of kind of development, it really changed how we do things. And again, kind of like the team that I've been working with, we've been working together for the last 10 years. So that was really interesting and required a thoughtful process. And I think that it's even kind of like ongoing. The second thing that I've noticed is how kind of like the investor approach has changed to from like investing your money in growing the team and bringing in more people to just like, oh, you don't need to be a big team now. So very happy that like we're not a huge team and kind of like always kind of like maintained, grew and we needed to. And the third approach that I'm seeing is a change, an approach that I've been seeing is on our customer side, and how customers are now kind of like becoming more comfortable and open with using technologies, asking about AI technologies, actually wanting it. If you show them structured algorithms, it's not good enough for them. So that has been really interesting. My prior company, Clear Genetics, developed a chatbot. And when we developed the chatbot, we had to explain to people what a chatbot actually is, why it's different than a chat box. And now people are asking to say, like, where's the chat? Where's the AI in it? But it's not AI, right? So like, I think that's also been really interesting.
People have really embraced it. That's recent. I think something that you mentioned earlier was of interest to me. You said investors are now kind of looking for smaller teams. Have you gone through that? And if so, like, what is it that kind of led to a smaller team?
Oh, we didn't shrink our team. So our team has 12 people. Like it's always kind of like intentionally been small. But when I meet now with kind of like investors, or kind of like when I read and interact with either our investors or investors that are reaching out to learn about Nest, like they're all like, oh, you could do so much now with a small team.
Yeah. Are there any AI tools that you found just to be amazing and they're used on a day-to-day basis? Anything you recommend for the founders here?
Except for Cursor that our team uses all the time. We use Magic Patterns for design, and like that's been incredible. It's been really good and helpful.
Nadav, if my question for you is kind of on like if your thesis has kind of been changing as of late. So with more and more companies now being able to generalize their coding, has that become kind of like a challenge in terms of like investing if that's kind of what their business is based off?
So first of all, it's a very challenging market to invest in. I would lie if I would say differently. I think the pace that things change is uncomprehendable. And yeah, we try very hard to be thesis driven, and we try to revise our thesis every once in a while. Right now, we are focused on trying to identify moats and what is actually a differentiator and what is not. I think there are many areas that are being commoditized in healthcare quite fast, I would say, and we don't want to be there. I think to compete in these areas, either you go all in, like you raise a lot of money and you try really to dominate that field. As an example, scheduling, scribing, all the front-end applications, or you try to tackle a more sophisticated with a higher threshold to enter type of an area with, again, a team with more special forces, X-Force and so forth. And yeah, we try to be very selective on areas we invest in or not.
Okay, so which of the two have you preferred as of recent? Is it kind of going to areas that kind of have a higher threshold for entry?
Yeah, that's, for us as an early stage investor, we really try to think of areas that are not in the main conversation right now, because if they have reached the main conversation, it's too late for us. Yeah. We want to invest in companies that will be there, hopefully in a couple of years. I can give you an example. I think for us as an early stage investor, our biggest threat is timing, is investing in companies that is still premature for the market is trying to tackle. We actually share our diligence with founders we invest in. So, and actually also with companies that we do not invest in, but we went pretty far with. With one of our portfolio companies, that CEO, he keeps reminding me, like, in our diligence, you wrote biggest threat is market not evolving fast enough for the company. And for the past 2 years, it was the case. But now kind of like market is catching up. So it's really great. So I think for us, just to summarize, we won't play in areas where we think like either you have a very, big chest of dry powder and you can, utilize these resources. We will prefer areas that are more niche, that are more specialized, that require a higher level of sophistication, if that makes sense.
Yeah, that makes sense. And kind of leads me to my next question. Is there anything that you're excited about over the next couple of months?
Well, months is a short time frame for healthcare, to be honest. I think right now what excites me the most is, US healthcare, I think we all know this number of like $5 trillion, 20% of US GDP, 20 cents on each dollar in the US is healthcare, and so on and so on. But the matter of fact is most of that is services. More than 80% is actually services, even more. And not so while ago, with software, with even AI tools that were, like a year or two ago, you were only able to tap into the IT software budgets that are essentially a small fraction of that big number. I think what we're seeing right now is the actual opportunity to replace service lines with hybrid models of software and people. This notion of, software, not SaaS, but service as a software. And that's a very interesting point in time in my perspective, because one, you can make the system much more efficient, and two, you are selling to buyers with existing budgets, as opposed to software where once upon a time you had to invent the budget, which was much more challenging.
Makes sense. And Moran, same question for you. Is there anything that you're excited about next few months with your company or the space that you're in?
So like in the kind of like short-term month horizon, I'm excited about some of the programs that we're launching that includes kind of like newborn screening, newborn whole genome sequencing at birth. So the state of Florida is launching that every child is born, they're going to offer them a whole genome and offer them kind of like results across their lifetime, which Nest is going to be delivering. On a more macro level, I'm excited because I think that it is inevitable that we will all have access to our genetic information, and that would guide our care. And I'm seeing kind of like progress towards that with our customers. Payers are coming there. There's a shift in that, and I'm excited for it.
For the founders that are in the room, would you have any advice on, fundraising and how to approach it? Let's say in the early stages specifically.
I think that decide kind of like what you need, how much money do you need to build kind of like a substantial milestone in your company that will allow you to kind of like go back out and raise again after you get to that milestone, and just kind of like focus on that. Just like focus on like what's the next thing you need in order to get to the proof points that take you to the next level, and raise the right amount that gets you there.
Yeah. Does anyone have any questions?
Moran, what are some examples that either you or things you've seen companies do early on that didn't scale, and then what did you do differently to make it scalable this time?
I think that one of the things that the companies that we've had were similar in the sense that they wanted to solve kind of like this delivery of care. So how do you close the gap between the fact that genetic diagnostics exist and there's a gap in bringing them to the point of care? The first company was kind of like in a niche that was around kind of like carrier screening, because that was the genetic test that was around. And then kind of like that mission grew over time because you could deliver more things. What I have seen kind of like some of the problems in scale, not with Nest, but some of our partners even, was kind of bringing people in to do different tasks. So kind of like growing the team instead of thinking first around kind of like automation. So how do we kind of like think software first in terms of doing support or doing, even if you have some, for our space, kind of like in-person telehealth genetic counseling. So how could you do as much as you can with automation instead of putting people into it?
Thank you.
Hi, Daniel Dudley, Grand Rounds Capital. Really love the conversation. I think it's great to hear your perspective. Question about the broader, your experience in the genomics market is with all of the things that are happening. I think one of the elephant in the room in many of these conversations is what's happening on the consumer side, with what happened with 23andMe. Have you seen the challenges, like how has that been an issue in the conversation as people are trying to improve access to genetic testing, to genomic testing, to kind of like provide this rather than oh, hey, we're testing you for these specific markers for this specific condition. You don't have it. Good luck. How is let's call it that consumer side of it played or not played into the broader clinical conversation?
Yeah, thank you. I think that's so interesting because for us, for example, like over the years, we were thinking about going direct to consumer so many times and trying to understand, I think maybe there was like a hype around 23andMe where 23andMe and Ancestry, like they were doing the World Cup billboard and you thought, oh, that's it, everybody's doing genetics. And then you realize, oh, like it's just recreational. Like once you start talking about health, they actually don't really like it. And I do think that the direct-to-consumer space is something interesting to pay attention to because not just in genetics, overall, like genetics follows the same trend that I think overall healthcare is shifting with to direct. So if you trust if people kind of are more comfortable to go online to get healthcare, and that goes beyond, over-the-counter medications or like things that you don't have to, like dermatology or things that are not, like if you would actually go to get medical care for serious conditions online, that then genetics would shift to that as well, I think. So we are trying to really kind of like see when that is and see where could we balance both delivering responsible genetics, medical genetics online with how that's being done in most cases today, which is still through their provider.
Hi, I'm Michael. Was a former product manager at Grail, but I'm exploring my next, move. So, I'm potentially a founder, but I'm kind of curious for you, Moran, if you have any stories or learnings to share from your experience finding your first partnerships or your first customers.
I think that it is a big numbers game, really. And then it becomes a combination of how good what you actually are building is, with the trust that you are building, with some luck. So if you kind of like have the combination of those, you speak with enough, you will find the right early adopters, and they kind of like bring the additional ones. So like for us, our first customers were Geisinger. And Geisinger was building so we were kind of like thinking about prenatal genetics, but had a really cool idea and solution. We talked to a lot of people. We were connected to Geisinger. We learned about, oh, you know what, like we're not doing a lot of prenatal, but we're sequencing 120,000 people here. Do you think you could help us with that? So I just kind of like recommend talking to a lot. Creating a good reputation, and learning kind of what's out there.
All right, thank you.
Just wanted to ask about your experience going through YC as a healthcare biotech company. I think we've seen them kind of expand to outside of tech to healthcare and biotech, but just curious how you thought about the resources and kind of how they value that they structure their deals as well, as a healthcare and biotech company versus traditional tech company.
On the investor side,
Both investment and
like how much healthcare systems are willing to pay, for example, for
I guess for specifically YC as being a healthcare biotech company participating in YC.
So I think about 10 years ago, YC kind of like started to look much more seriously in healthcare and started to kind of like think about, so initially was kind of like putting together, they said 10% of the batch is going to be healthcare. Then they grew that to 20% of the batch, and then they brought a YC healthcare partner because they kind of like around your discussion, like just like understanding that you need somebody that understands the space in order to grow and evaluate the space. So I think that has been a very big focus of them for a while. I don't know what's going on now. I think that in general, kind of like healthcare doesn't fit in most cases the traditional growth and behavior that happens in traditional tech. And you just like have to have the appetite and patience for that. So I don't know recently what's going on, but like when we started both of the companies, they were definitely very interested and believed very much in healthcare.
Yeah, hi. My question's on the market in general. Like in terms of adoption and research in genomics to what clinicians are actually using, like how much of it is pull where they're asking for certain use cases and how much of it is you making bringing to their awareness what's actually possible in genomics in different use cases?
Yeah. I definitely think that it is much more a push than a pull. Right now, I think there's awareness, like there's increasing awareness on the provider side that genetics is becoming part of every specialty. It could add options to my patients. There's a shift to proactive care rather than reactive. So I think there is kind of like growing awareness, but I think that the activation effort in order to actually implement genetics in practice is like so high that it's too much effort to do. And what we do is really kind of like reduce that activation effort. So it's very easy to deliver genetics when you want to do that to your patient. So kind of like, I always think they want to know who to test, what to test for, what do I do with the results? And in terms of kind of like the world of opportunities, because that awareness really exists on what is becoming mainstream, it's very hard to bring to them, like even I think about polygenic risk scores, like things that are new and there's not enough evidence or they're not enough mainstream to implement them. They're still in areas where it's clinically actionable, that kind of like people have like that has been around for a while, especially like in mainstream providers, not kind of like the specialists.
Hi, Moran. I'm Faraz. I'm co-founder and CEO at ChangeGenius.ai. Kind of solving the same bottleneck as you. So we are raising our pre-seed, and I just want to know, Invade was already a customer of GM, Clear Genetics, right? Yeah. So was that deliberate, having your acquirers as your initial customers? Was that something that Clear Genetics deliberately did, or was it it naturally?
Invitae was a very interesting company. So now it's part of LabCorp. The company that acquired Clear Genetics, their name was Invitae. It was a very, very interesting company. It was innovative in its approach. It substantially reduced the cost of genetic testing. It had a founder that I dearly respect, and unfortunately, it's not around anymore. It was acquired by LabCorp. I think that our mission for Clear Genetics to integrate genetic information into care was something that aligned very strongly with Invitae, and I really believe that if we bring Clear Genetics into Invitae, it would have the scale and footprint of the Invitae sales team and would reach all of the healthcare organizations. My vision for bringing genetics to every patient didn't change from Clear Genetics to Nest. So just have to go and build it again, unfortunately.
Gotcha. Thank you.
Can we give a big round of applause?
Thank you very much.